Hello, I'm Derek Scholes, registered dietitian nutritionist, as well as to-be physician in May 2024. And today I'm going to be going over how to obtain order writing privileges for dietitians in facilities that do not yet have these privileges. So some of the learning objectives, including describing the process of obtaining these order writing privileges for dietitians, as well as the purpose of obtaining them. Additionally, to identify and explain how to go about obtaining these privileges and how these improve the role of the dietitian within the organization, as well as how to formulate a plan to obtain these capabilities for dietitians, as well as to teach this to another person. In 2014, Centers for Medicare and Medicaid came out with a ruling that allowed dietetic professionals to have these order writing privileges depending on what state they are in and the state regulations, as well as their hospital policy and regulation. However, many facilities still do not allow dietitians to have these order writing privileges. And this could either be based on state regulations, the state still does not allow them, or because they choose not to change their hospital policy, or because they have yet to change their policy. And clinical dietitians are at the forefront of this change, both within the facility as well as the state level. And we're going to discuss some of these, not so much about how dietitians have changed state policy, but more of how they can go about changing facility policy and promoting change within their own facility if the state allows. Some perks to this are that obtaining order writing privileges increase the scope of practice of the dietitian. It also improves patient care and outcomes based off of improving therapeutic diets, as well as reducing unnecessary TPN, as well as decreased expenditure, also to do with decreasing TPN usage, as well as improving patient outcomes, which can decrease length of stay of the patient, as well as improve patient outcomes. As well as improve diagnostic capability of the dietitian, because dietitians will be able to order their own labs, for example, or diagnostic studies. Downsides are increased work. Dietitians will have to work more because they will have to put in these orders, as well as if there's a limited workforce, this may not be a plausible idea or solution. There is greater responsibility, which requires competency assessments, as well as it'll increase the amount and frequency of assessments that need to be performed to verify that dietitians have the capacity and capability of doing these orders. Now, in order to implement order writing privileges in a facility that does not have these privileges, we first need to understand what the CMS ruling states. So we'll discuss a little bit about what it used to say, what it says now, and what the interpretations of both were and are, as well as we need to know what the regulations are of the state that we live in prior to be able to establish it in a facility. Because if the state doesn't allow it, then we might have to focus more on finding how to change policy at the state level before trying to establish it at the facility you work in. Once you verify state regulations, you need to establish support within the facility. And we'll discuss a little bit more about this. Developing policy, which includes the privileges, order writing privileges, what that'll entail, as well as determining what the competency is and how you'll assess them. So this can be knowledge-based competency assessments, practice-based, and so on. As well as a monitoring and evaluation system needs to be set in place to be able to verify what changes are coming about based off of the implementation of order writing privileges. Now, the CMS ruling in 2014, it's also known as the section that applies to dietetics as food and dietetic services. The old wording used to say therapeutic diets must be prescribed by the practitioner or practitioners responsible for the care of the patient. Now, that's very vague, and we'll discuss what the old interpretation was in a minute. However, the change was to all patient diets, including therapeutic diets, must be ordered by a practitioner responsible for the care of the patient or by a qualified nutrition professional as authorized by the medical staff and in accordance with state law. So we'll discuss both of these in just a second. So the prior interpretation was that only physicians could prescribe patient diets. However, the dietitian needed to assess the nutritional needs and provide recommendations to the physician, as well as perform the consultations for the patient. Now, with the new changes, a dietitian may write all diet orders, which include enteral nutrition and TPN, and as well as all diets are considered therapeutic. And the rule does not rule out ordering labs or other diagnostic studies. So if a dietitian would need to, they can request magnesium, phosphorus, and so on, whatever is necessary. So the hospital governing board is to decide what orders dietitians can write. And this can also have some influence from the dietitian based off of what policy they write for the facility, but the hospital governing board has the final decision. And only for inpatients in the hospital setting and in LTAC. So only inpatients as well as long-term acute care patients are able to receive this care by a dietitian. So dietitians in these facilities, if they do not yet have these order writing privileges, can strive to obtain them. So this also entails a few changes in dietetic practice. First, these become a billable service. So dietitians will need to have an NPI number. So if this is currently not acquired by a dietitian, they will need to acquire one. Privileges are also given based on hospital authorization and should be done by dietitian competence and expertise. So this entails that the dietitian should meet certain competency requirements as well as certain, I should say, experience or educational level. And then the competency assessments are developed to be able to assign these privileges. And then policy is established to define the scope of practice, the privileges, and also the requirements for privilege approval. Now, when it comes to understanding state regulations, it's often very obscure on really what your state may say are regulations for the dietitians. There are a few tools that are in the links at the very end that may help you be able to kind of uncover what these are. However, sometimes you need to go search specifically by state, and sometimes you may even need to reach out to the state or legal help to be able to uncover really what the regulations are. So state licensure and certification are methods to protect the dietetic profession, but they do not mean that the dietitian has the capability of writing orders within that state. It's usually a separate clause that allows or does not allow for this. And even in states that do not regulate dietetic professions, if there's no specific clause that says the dietitian can't have order writing privileges, it's usually assumed that facilities can approve the dietitian for these privileges. But it is always best to discuss with the legal department prior to developing a policy to just verify that the state regulations allow for it. Now, to establish support, sometimes at the very beginning, you might have to do a quality improvement project or some sort of project to help show the need for order writing privileges for the dietitians. And this can include patient satisfaction, it can include outcomes, and many other things. Also, to establish support, like I mentioned, it's important to talk with the legal department to show kind of how order writing privileges for the dietitian can improve the hospital, at least with the legal standpoint. And then also gain support from physicians, clinical pharmacy, and nursing. Physicians are the ones who currently have order writing privileges and should know about the changes and should be able to support the dietitian in this and understand kind of the balance between who should be writing the orders and how that'll function. Clinical pharmacy should know, because if we're sending a TPN order in, they should know that dietitians do have that capacity of writing them an order and they should be able to accept it. And nursing will be working directly with nursing because we're submitting the order and then they'll be actually putting it on the IV, for example. So cost and benefit discussion. This is a very important factor to discuss, like how malnutrition will improve if dietitians have the order writing capabilities, how to reduce inappropriate TPN usage, as well as, for example, the estimated total economic impact of $459 million annually if dietitians, and this is countrywide, will be saved based off of hourly costs if dietitians were doing these orders instead of physicians or PAs. For example, because dietitians aren't paid as much as physicians or PAs, and if they're doing these orders instead of physician or PA, they'll be saving money in that standpoint, as well as the committee approval. You'll need to have approval prior to being able to even get the order writing privileges set. So to develop policy, we need to establish procedures. And this procedure could be based off of like what the dietitians will be doing, how they'll be doing these orders, what orders they're capable of doing. And then this will also partially go into how to define privileges. Now, privileges should be developed as groups. So for example, if someone has a competency, like they just started working, their privileges can be diminished so they can only order so many things like regular internal nutrition or like the diets and therapeutic diets. And then as they improve with their expertise and competency, you can add on TPN, you can add on labs and so on. And then their responsibilities should be outlined. And then approving methods of communication with the physicians, with pharmacy. And so like if they can use their phone, if they have to do written communication and so on. And then competency benchmarks should be established, and then the assessments as well should be created. And these can include learning modules such as knowledge-based learning modules, as well as simulation. So having them actually perform it in front of you to show that they have that knowledge, or you show them how to do it and they'll do it back. Then practice-based competencies will focus more on how they are actually performing. So you'll do like chart performance reviews as well as observation of their interactions with others. And then you can review to ensure that their care is consistent. So this can mean like how their orders are, if they're consistent with their orders, and so on. So kind of like I mentioned before, there's different ways that privileges can be created. It can be created based off of like education. It can be created off of like expertise. So like if they're doing renal versus gastroenterology, and it can vary widely on the facility. So this should just be created in discussion with the dietitians in the facility as well as with hospital administration to see kind of what best fits the facility and the facility's needs. So like I'd mentioned, they should be based off of the competency, education, and experience. And here's a sample of for example, one that was created by ChatGPT of how one can be set into place. So this might not be the best option because there's things that I didn't edit that could be seen as not necessary. For example, a doctorate degree in dietetics or related fields, just to be able to write TPN orders, may not be necessary, but more of clinical expertise. Okay, but this is a possible example that could be used at a facility. And once these privileges are set, you need to discuss how will you monitor and evaluate the progress. So one thing kind of what we discussed before in the policy is you need to assess these orders that they're doing, do their performance reviews, see if they're compliant with the privilege criteria, and then review patient outcomes to the related orders. And then you can use QI projects, QA-API projects to see like the efficiency of the TPN orders, if you're reducing the amount of inappropriate TPN orders, as well as multidisciplinary compliance with RDN recommendations. Are the nurses actually getting these TPN orders? Are the physicians changing the oral diets or the therapeutic diets, etc.? As well as you can also see patient outcomes, length of stay, as well as cost, for example. All these can be part of the monitoring and evaluation. And so overall, there's so much that comes into this, but when you create this policy and then present this to a facility, it can show that you are competent in what you're asking for, and show that there is a need for order writing privileges for the dietitians. And this can help improve the scope of practice that you have in patient outcome. So here's many references. Some are documents, and you can go through these, as well as, for example, the link to the chat or the chat GPT thing that I put in. And this leads to kind of the module materials that need to be gone over for this assignment, okay? So the learning materials, it's important that you read, for example, this quick blog post on Dietitians on Demand that help understand a little bit about how you can be successful at applying these CMS rulings. As well as I'd like you to read the CMS ruling itself, the section 3 that's on food and dietetic services. And this link will take you straight to that. And so it's important to see the wording and see exactly what is this saying so you can discuss this with your facility. And so here's 2 documents that are provided by the Academy of Dietetics, Nutrition Dietetics. And it discusses how you can propose these order writing tips for privileges, as well as how to implement these steps in your facility. You can quickly scan through it, or you can read it. They're fairly long documents, but they're very beneficial in being able to apply this if you really are in a facility that doesn't have it. However, if your facility already has order writing privileges, just go through the steps and you'll refer to these a lot in the assignment. And so when you're done reviewing section 3 of the CMS ruling, it's important to write a description of the ruling and how it changes your practice in dietetics. So this is the first part of the assignment. And then later you'll go into how to search for state rulings. Now, there is one important factor. If there's no specific state requirements, if you do your best and still can't find out what the state requirement is, it's just possible that there might not be any. So you can either discuss with the legal department before doing this assignment or after looking at this question, or you can just state that you could not find it and discuss what process you went through so that we can understand the difficulties you've had with looking for the state ruling. So even if your state doesn't allow it, we want you to be able to understand how to get into the flow of implementing this. So I would like you to create a plan, more of an outline, 300 to 500 words, and how do you implement this at your facility. And you can look at the at the step 5 and implementation steps, as well as the other steps to be able to help create your plan. And these are the 5 specific questions or 6 questions that you need to respond to get credit. And so who will be involved, how you obtain their support, policy outline for the order writing privileges, so it can be bullet pointed if you'd like. Describe the privileges that will be established, as well as how to assess the competencies, and then monitoring and evaluation. What will you be doing if you're going to be doing a project, if you're going to be just doing data collection? And so I'd like to see that in about 300 to 500 words, as well as teach this process to someone else. And you can discuss how this went in 150, 200 words. What went well, what could be improved on, what are your additional thoughts? And that is it. Thank you so much. If you have any other questions, you can always go on to the references, and they should be able to help you understand what you should be looking for in the assignment. Okay, thank you.